Health Minister Dr Joe Phaahla says it would be irresponsible to drop all COVID-19 regulations. Last week, President Ramaphosa announced the lifting of the state of disaster and plans to move to another preventative health dispensation. Earlier, Dr Phaahla and his deputy, Dr Sibongiseni Dhlomo, briefed the Parliamentary Portfolio Committee on Health. They outlined the progress made with regards to amending the National Health Act in order to make provisions for the country's COVID-19 strategy going forward.
The fourth wave of Omicron has just gone through. We're at the trough, at the bottom end, but we know that this is an experience we have gone through. So until such time that it can now be confirmed that either maybe the virus has burned out or the immunity in the society is such that there is no further risk. We believe that we still have to have public health measures, but also we can see what is happening in various countries, including countries which have had even more higher rate of vaccination at 70-80%, some even at 90%, but experiencing new rises in infections. So that is why government has then come to the position that we cannot continue using the Disaster Management Act. We need departments to then come with other provisions which we can use. And from the health side, we have looked at the notifiable medical conditions regulations which were already promulgated in 2017. I emphasize this point, honorable members, because in the public out there, there's maybe a misunderstanding, and I suspect even from the feedback we get from some of the honorable members, there is a misconception that these are completely new regulations. As you will see from the presentation, there has been some measured amendments in some cases, but in many cases, it's basically an amendment on regulations which actually have been in existence for the last 5 years, from 2017. So that's what we will be presenting, and we just want to assure the honorable members and the public that there is no desire from myself as a minister and the team from health to want to continue to control people's lives unnecessarily. This is purely in terms of making sure that we do have instrument through which this threat, which still exists, we are quite conscious of the fact that if we totally just drop everything about containment of the pandemic, we have seen what has happened in our case, but also what is happening even in other parts of the world. So our advice is that it will not be a good direction to simply just drop everything.